start recording?
Yep, Jason, go ahead and get started.
Thank you. Well, good afternoon, Mayor Pro Tem and council members. Again, we're here to provide the latest update on COVID-19, where we're at and where we're heading over the next month and couple months. So first I'll dive into the data. So sorry if you do the next slide. So you can see from the previous week to this week, we've had 90 more cases and 2 more hospitalizations. But again, thankfully, no more deaths, which is good news. Next slide. And according to the current COVID dial, our 1 week cumulative case incidence is at 127. So again, we've been hovering around that for a period of time. Also, our 1 week percent positivity or average positivity is back up to 5.5%. So we're fluctuating again over that line as well. And we've had 11 days of declining or stable hospitalizations. Next slide. So the governor announced this last week, but what we're seeing with cases, percent positivity, and hospitalizations, that they're all increasing. And we in Colorado appear to be entering into our 4th wave. Nationwide, there's been discussion of that we are in a 4th wave, and we see some of those states that are being pretty hard hit right now, especially Michigan and Minnesota, and that's due to the rapid increase of the COVID variants, the B.1.1.7 specifically in those states. Our transmission control is still at 68%, and again, our reproductive rate or number is at 1.08. So this further indicates that our cases are going up and prevalence is going up. A little bit more concerning to us, and the governor talked about this, we alluded to it in our presentation last week, is that we're seeing hospitalizations in our younger populations, and that's into that 18 to 50-year-old age range. And it's not totally clear on why that's occurring. Some people are hypothesizing it's due to the variants. Some of it may just be due to the increased community spread we're seeing. So we'll just have to wait and see how that plays out and if we get more data on that. Again, approximately 30% of Coloradans are either immune due to either their vaccination or previous infection. And as I've shared numerous times, they're estimating that 69% of the Colorado population will be vaccinated by May 21st. That's that key date we're aiming for. And the School of Public Health alluded to this, or there was one of their major conclusions, that delaying policy changes until mid-May will prevent a large number of deaths and hospitalizations. And those slides are included in our appendices. In Broomfield specifically, we're seeing elevated incidence growth with increasing positivity. And again, our hospitalizations are fluctuating. Our wastewater data shows an increase in the detection of COVID-19 from the previous week. And then update on variants, we've had 13 cases of the B.1.1.7. And again, in the state, over 50% of the cases being sampled now are being identified as the B.1.1.7. So it's becoming the predominant strain in the state. And we're in the top 6 as far as states that have the highest number of cases of B.1.1.7. We still have the California variant, and most concerning, and you probably saw the headlines over the weekend in Boulder, the Brazilian variant is, there's 4 cases now in Boulder, and we have 1 case specifically in Broomfield. And this is the one that we believe the vaccine may not be as effective against. And so this is one that is definitely concerning. Next slide. So when you look at this, sorry, this is a little bit hard to see, but we're trying to track where we're at as far as our percent of our population that are either initiated or completed the vaccines, because we know there is that level of protection even when you've initiated the vaccines. And what you can see is nobody has a defined target, but nationally they've been talking about to reach a herd immunity somewhere between that 70 to 80% of your population. And right now, when you look at our eligible population, the 16 plus, over 52% have initiated or completed a vaccine. And when you compare that to the percent of our total population, we're at 42%. So again, Broomfield's doing extremely well in these areas. The next slide. And this just further illustrates what I was talking about. And as much as we can keep focusing on getting the vaccine out now to our younger populations, that'll be critical over the next month. We continue to have the First Bank Center is a vaccine site that's been going extremely well. We also partner with Thornton Fire. We've been doing our second doses, and we just received word from the state that we may receive additional supply of the J&J vaccine for this week, which would be great. Next slide. So we talked a little bit about this last week, but I just wanted to go over it again because I know there's some questions specifically at the council meeting. So to be extremely clear, the state had a face covering order in effect from March 5th to April 4th. That statewide face covering order, again, restricted or prohibited, or I should say, mandated the use of, I'll say, face coverings in indoor settings. And that's what we've mirrored in our local Broomfield in face covering order. The state did modify that face covering order on April 3rd, and it goes through May 3rd. And again, the one gap there was those, you didn't have to wear a face covering if you had 10 or less people in a business or entity. And that's what initiated us to move to update and issue our face covering order. The other thing, again, is the statewide dial 3.0 is in effect right now, goes through April 16th. The governor has confirmed it'll devolve and be turned over to locals on April 16th. And what you'll see is we've talked about from April 16th to May 15th, we're aligning with our regional partners to have a phase one where we operate in level blue. And then from there, a phase two from May 16th to August 16th, which is, I like to say, just an observational period. So as we move to level clear in phase two, we just want to observe what's happening, and specifically from a severity perspective. So next slide, I could go into details with this. So back to our local face covering order, I just want to again emphasize it's effective from April 8th to May 7th. At that point, we do have the ability to reassess and see if we still need it after then. I want to make this extremely clear because I think there was some confusion over the weekend. This order only applies to indoor settings. It does not apply to outdoor settings. So I want to make that extremely clear. That being said, the CDC continues to recommend wearing a mask outdoors in public settings when you can't maintain 6 feet of social distancing. We're following that same level of recommendation, but we know, again, practically, this is if you're in settings where there may be a public setting, a bunch of people that are gathering. But if you're out walking and you have somebody passing you by and you're not within 6 feet of each other, we're not going to go out and start tracking people down as far as who's wearing a face covering or not wearing a face covering outdoors. We know most of the transmission occurs indoors. Next slide. So as far as the regional local public health order, the regional approach includes the following counties: Denver, Boulder, Jefferson County, and then Tri-County that includes Adams, Arapahoe, and Douglas. And the reason I said maybe for Douglas is Tri-County's orders allow for counties to opt out. At this point, my understanding is both Adams and Arapahoe are not going to opt out, but Douglas is considering if they want to. So I just wanted that to be clear to council. As I mentioned before, on April 16th, we would move to level blue, and that would stay in effect until May 15th. And we're getting away from moving people back and forth during that period of time from blue to yellow and back to blue. The idea here is let's move to level blue, test it out for a month and see what happens. And specifically, really looking at what happens with cases over that period of time, and also our vaccines, if we're able to continue to vaccinate as we are on our current pace. And then from May 16th to August 16th, we're calling it level clear, which basically means we're opening up in all of our counties. And so all restrictions would be lifted. And the reason we're using the term level clear is because we'll still have public health guidance that we're providing out to people that we're recommending and following based on the data and the literature, but it would no longer be specifically incorporated as restrictions in an order. And the idea behind this is that we would move away from looking specifically at case incidents and look more at severity metrics, because we believe by that point in time, we'll have vaccinated, again, 69% of our population in Broomfield, maybe faster than that. And so based on that, we wanted to focus more on hospitalization. So based on this model, if we saw an increase in hospitalizations or severity of the virus, what it would allow us is to reinstate some of the restrictions. So if our metrics for a 7-day consecutive period and we use a 14-day rolling average, we're at over 2 and up to 3 hospitalizations per 100,000, we could go back to level blue, and then you can see what the other ones were. And I want to show you what this means for Broomfield, because I don't think it'll have a great impact on us. And again, with our vaccinations rolling out, I really hope we wouldn't have to use this tool. So Sarah, can you go to the next slide? This just shows you how we've charted over the COVID pandemic. And specifically, you'll see the only time that we got above 3 was when we were at our peak during the November and December period. And again, same, getting above level 2 was when we had that real significant increase in November with cases, which led to increased hospitalizations. From there, you can see we've been in that level clear. And again, my hope would be that we would stay there over that period of time. The next slide. So as far as what this means, we will still be following all of the level blue capacity limits. So this should be nothing new to our public and to our businesses, because we've moved to level 2 in the past. The only 2 things that we have addressed is 2 other counties are looking at having potential restrictions for outdoor events in the month of May. And that was trying to cap them at 33% or 66%. We had talked about that last month. We discussed this internally, and given the fact that we don't expect any large outdoor events coming up in the month of May, we felt like as much communication that we have back and forth in the city and county of Broomfield, that we can address that by working directly with those events. And then personal gatherings. I believe that Boulder County is going to include personal gatherings in their order, but the rest of us aren't. And the reason Boulder County is they're concerned about the 18 to 24-year-old population, the college students, and congregating together and having more than 50 of them together and saying it's a personal gathering. So they're going that direction. We're going to just recommend that for personal gatherings, we follow our CDC guidance. And then the 5-star back to business program, counties are leaving that back in. But one of the challenges under the current state order, it says that you cannot operate in anything greater or less than, I should say, level blue. So you can't go to level green with a back to business program. And so what we're doing is suspending it for this period of time for a month, having everybody operate in level blue. And then if for some reason we did have to go back due to that severity metric and go to level yellow, we would be able to have that back to business program up and running again and having them operate at that level blue capacity. So next slide. And that concludes the presentation. So me, Sarah, Deb, and Jeff are all here to answer questions, and Christina, who has helped along with Pat and Nancy in drafting both our indoor face covering order and also the dial order that we're working on today. So I guess we could go ahead and start with questions. Councilmember Lim?
Yes, that's good news that we are getting more vaccine this week. Could you address the question that would be relevant from those who have been watching the news? Do you have any hesitation with the J&J vaccine? We know that it had some problems with a few people who received it in other places in Denver.
Yeah, actually I don't. And I checked in with our medical officer, our EPI team, and also with CDPHE. Again, there were some adverse reactions to the J&J, but they were following the appropriate protocol, which was to monitor those individuals for the 15-minute period. And we know the number of vaccines that are being rolled out that you are going to unfortunately just have some of those adverse reactions. That being said, my understanding, the reason some of the large drive-through sites are moving away from it is they want to have adequate time for that 15-minute monitoring period. And so they don't want people just getting their vaccine and then potentially driving home without having that time to make sure they're monitoring them and then releasing them. So I felt comfortable, and Deb checked into that as well. And Deb, I don't know if you have anything to add, but we're good with offering it. And actually, we're glad to see that we're getting the J&J supply because it's a 1-dose vaccine, so we could start to knock people out faster.
Yep, I think you covered everything, Jason. And as you indicated, we offer in-person appointments at the First Bank Center, so people will be held for the observation period after receiving the J&J vaccine tomorrow, and we are more than adequately staffed in terms of medical professionals and volunteers that will be overseeing that area and are prepared to respond to any sort of reactions to any vaccine, including the J&J. So I agree.
Okay, that's great. Thank you. And could you expand on any further information about the Brazilian variant? So, Jason, you alluded to the fact that there's discussion or whether the vaccine would either, I guess, any vaccine would be as effective with the Brazilian variant. Is that the is that the main problem with the Brazilian variant? The other variants, I know I've read that they have a higher transmission rate in that. So could you, what's going on with the Brazilian variant?
Yeah, specifically with the Brazilian variant, and I actually pulled it out in front of me. One of the concerns is the impact that has on our mononuclear antibody therapeutics. So it does impact some of the therapies that we're providing as people are going in for treatment, i.e. hospitalizations. And then one thing we're also seeing is the potential for reinfection, and that was what had happened in Brazil. It was prior to the vaccine rollout. Some people had COVID and then they were reinfected with it. As I mentioned before, the data is still emerging on the effectiveness of the vaccines against this specific variant. And at this point, public health professionals are just, again, saying we should be cautious and watch it and examine it as we get more data around this specific variant and the potential impact it could have.
Okay, and how do we know that we have one case in Broomfield and they have 4 in Boulder? I mean, is it statewide testing that's determining how this Brazilian variant may be spreading throughout the area?
Yeah, so typically, again, the state takes tests that are performed, and then out of that test, they call it a S drop. They're looking for a specific gene that drops within the virus that they pull, and they do additional analysis on. So within those specific samples, they're looking at, okay, if you have an S drop, what's the actual confirmation based on the genetic code of that? So which variant is it? And from there, they're able to identify the variant. And so CDPHE, through their lab and also working with private labs, is the ones that are collecting that information. And then they inform us as the local health department, and we coordinate then with them on the epi investigation.
Okay, thank you for keeping us informed on that. That's it.
Thanks, Councilmember Lim. Councilmember Schaaf.
Thank you, Mr. Valling. So if I'm understanding the plan ahead for the next month, we will be going from blue to clear. Does that mean we're skipping green altogether?
Yeah, so once we go into level blue through May 16th, and then we'll go to level clear. And the reason we felt pretty comfortable with that as a Denver Metro public health directors is we believe on the current modeling as far as the vaccine uptake, and then secondly, looking at the delays in policies, that we're hopeful by May 21st or May 16th that we're at a place where we don't have to go down to level green and then phase off. We believe we'll be at a place where we can go to level clear.
Great, thanks for that additional information. That was going to be my follow-up question. So one of the things that that we're seeing, and you pointed this out, was the 20 to 29-year-olds, the dramatic increase in cases. We're also seeing a dramatic increase in that 10 to 19-year-olds, and the 10 to 16-year-olds are age demographic that doesn't have the ability to get a vaccine at this point. So those numbers are concerning, and I don't think it's just a Boulder problem. I think that here in Broomfield, obviously the data is showing us that we have that age group that is increasing in cases. So I do have some concern there, and how quickly that uptick in cases is happening. Another thing out of that data was the ICU beds dropped dramatically in early April. Do you know what happened? Was that just a misreport, or what occurred in that early April to decrease those ICU beds so significantly?
That I don't know, Councilmember Schaaf. I'll have to follow up on that. That's a metric that Sarah tracks with our emergency preparedness coordinator. So we'll see if we could get more specific information on that one.
Okay, thanks. And then testing sites and places for individuals. Do we still have the availability for people to get tested? I think within Broomfield, it's by appointment only now, but outside of here, are there still those statewide testing facilities still open on a regular basis for people to get tested?
Yeah, I'll let Deb address that one, but my understanding is we still have the sufficient testing supply. Our biggest challenge right now is encouraging people to continue to get tested if they're experiencing symptoms or they have been exposed to somebody that has COVID-19. So Debbie, you want to take that one?
Yeah, so I think two things. One, and I think Sarah shared this last week, that we are seeing that our testing rates are still within the acceptable range for a community our size in terms of the number of tests being administered, as well as we continue to be confident that there's sufficient capacity amongst different providers to administer at least over 105 or more tests daily. And so on our website, broomfield.org, I think, is it under COVID testing, Sarah? Is that the URL? Yes, broomfield.org/COVID testing. We do continue to list all of the sites that are in and around Broomfield where residents can access tests, including free sites that are operated by local providers. So at this time, we still believe that there is sufficient capacity for testing that our residents can access.
Great, that's great to hear. And I heard this great news story this weekend talking about the demand at this point is still greater than the supply of vaccines. So I think that, testing in that is still going to be important. And we're kind of in this middle ground. So my last question goes into vaccines. So people that are displaying symptoms within that 1 to 2 doses of their vaccine, what is the recommendation for them? Should they be getting tested at that point, or what's the recommendation?
Yeah, great question, Councilmember Schaaf. The CDC recommendation is that if you are experiencing symptoms and you have received your first dose or even your second dose, that you still get tested for COVID, just to make sure, because we know that the vaccines aren't 100% effective against contracting COVID again. So, to be cautious, the recommendation right now is, even if you're fully vaccinated, if you're experiencing those symptoms, please go get tested.
Great. Thank you so much. I appreciate all the answers.
Thanks, Councilmember Schaaf. Councilmember Grimm?
Sorry, I have to jump off real quick. I was just chatting. I was just leaving you a chat. Let's see, I do have about 60 seconds before I have another meeting that I've got to jump off to. And my question was associated with the sporting event. The organized sports, it says 50 participants per activity, but that doesn't say indoor or outdoor. But then down below, it says indoor events is 50% capacity and outdoor events is 100% capacity. So why is organized sports different for events versus non-events? Indoor or outdoor events?
Yeah, Deb, I'll let you address that.
Sure, Councilmember Groom, good clarifying question. So the organized sports limits only apply to the participants, like the actual number of athletes. So previously, for instance, in level yellow, that's limited to 25 per court or field. That could be playing basketball or soccer at any given time. Moving to blue, that can increase to 50 athletes that could be on a court or field at any time. And then the spectators that are there observing the organized sports activity are subject to the indoor-outdoor event guidance. So let's say we're talking about a soccer game, you could have 50 athletes on the field between the two teams, and then you would have the spectators would be subject to that outdoor event guidance, which means nobody has the number of spectators. They just need to remain 6 feet between households. Does that make sense?
Yeah. So like if you were 2 sports or 2 teams playing each other, you could only bring 25 each.
Correct.
Oh, I get it. I get it. Thank you for that clarity. All right. Thank you very much.
Thanks, Councilmember Graham. Mayor Pro Tem?
Thank you, Jason and team, for the update. My question is regarding the back to business certification. So are we going to kind of shelve it for the next month then and just allow our businesses to operate in blue?
Yeah, I'll let Jeff take that if he wants to, and I can add to it. So go ahead, Jeff.
Mayor Pro Tem, Jason and I and Deb and CMO have had conversations for the last couple of days trying to think through this exactly. If the back to business program were the way it was intended to be, we'd be allowing our businesses to be in level clear, which we don't think is probably appropriate yet. We want this 30 days. And so the thought is we would have all the businesses in Broomfield operate at level blue, and the level blue is really kind of the local level blue is a little bit of a mix of a green blue. And so, because it's 100% capacity and the 6 foot is the thing that's really the determining factor. So it makes the most sense. The reason why we called it suspended is just in case, and knock on wood, please, everybody. But if we were to have to move back because of the 4th wave potential, we want to have it in place so we don't have to start all over again. And so we're just going to tell everybody it's suspended, and we hope that at the end of the 30-day trial, or not trial, this 30-day period, we'll be able to actually close the program out.
Thank you. That's all I have.
Thanks, Mayor Pro Tem. Councilmember Anderson?
Thank you. I have similar questions to last time. Do you have an update on the ages 12 and up? Are we getting closer?
On the approval of the vaccine?
Vaccine.
Yes. Yeah. So that's great news. Actually, Pfizer has submitted to the FDA for emergency use authorization for 12 and up of the Pfizer vaccine. We don't know what that's going to look like, but some timelines that have been thrown out is the CDC director estimates it could be approved by mid-May, which would be wonderful to begin to be able to start vaccinating our 12 and older population.
Okay, thank you. No, that's very good. And then for ages under 12, there's no anticipation of any type of vaccine. There's nothing on the horizon that we just try to keep that group isolated as much as possible. Is that kind of the plan going forward?
No, I think what they're going to do is they're first focusing on 12 plus for looking at the effectiveness of the vaccines through clinical trials with that population, and then they'll start testing it with younger populations after that.
Okay, so it's coming. That is good. And then do we see? I was surprised by it's nice to see it was a 60 to 70 somewhere in there. I forget what the number was, like 90. It was well over 90% that have been vaccinated. Do we see any hesitancy on the vaccines here, or do we suspect that we can get up to those numbers and reach 70 to 80% and herd immunity? Do we feel good about that based upon what we've seen and the backlog of people still wanting to get vaccinated?
Yeah, I would say with our current vaccine uptake, we do see a population that definitely is interested in getting vaccinated. And Deb and I have run some projections, and based on those projections, if it continues as we anticipate, we don't think there'll be major issues in Broomfield. I think some populations obviously we'll have to work with is our Latinx community. We're seeing across the state just disparities in vaccine uptake, and it could be partly due to vaccine distribution, but secondly to vaccine hesitancy. So as we've talked about before, our community ambassador program and other outreach is critical to address some of that vaccine hesitancy. And then the only other area where there could be potential for vaccine hesitancy is in those populations that they're contemplating whether they should get it or not. And then they start to hear some of those personal stories of somebody that went through their own experience. And so another thing that's being rolled out statewide is a statewide messaging campaign, specifically addressing some of those concerns that individuals have. And hopefully through those two methods and us continuing to push the message locally, we'll be able to address that and get us to that herd immunity.
Okay, that is good to know, and I'm glad there's a focus on the groups that, as needed. All right, thank you very much.
Thanks. Any additional questions? Well, with that, I'll conclude by saying, based on last week's meeting, we are looking to finalize our order, hopefully tonight or early tomorrow, to be ready to issue to, again, align with the region. So we'll obviously communicate with council before it goes out, and most likely it'll be through email, but I just have to give a huge shout out to our legal team. Christina, Pat, and Nancy have just been wonderful helping to craft these orders and making sure they're covering all of our bases. So look for something from us tomorrow on the specific local dial order, and we'll go from there. Thanks.
Thank you, public health and legal team.
Appreciate the support. Thanks, y'all.
Have a good afternoon.
You too.
Bye.
Bye.